RAPID Incorporated unveils key strategies to enhance HCC coding accuracy and compliance. RAPID Inc. Healthcare Environment, the pressure on healthcare providers and coders to maintain accurate documentation. In today's fast-paced healthcare environment, the pressure on healthcare providers and coders to maintain accurate documentation while managing large volumes of patient data can be overwhelming. One of their biggest challenges is closing hierarchical condition category (HCC) gaps, which occur when relevant diagnoses are missed or underreported during risk adjustment coding. These gaps jeopardize compliance, lead to missed opportunities for proper reimbursement, and can negatively impact patient care. Consider a healthcare provider working in a busy clinic who notices that the HCC codes for several patients don't fully capture their health risks. This isn't just a technical oversight, it directly impacts the organization's financial stability and potentially compromises the quality of care delivered. For providers and coders, closing HCC gaps is crucial to ensure compliance with Medicare regulations and secure the right level of reimbursement for patient care. As more healthcare organizations focus on improving their risk adjustment processes, addressing these gaps becomes even more essential to optimize coding accuracy and stay compliant. Understanding the importance of HCC gaps. HCC gaps occur when discrepancies in the coding of a patient's diagnosis occur, usually resulting from incomplete documentation or misdiagnoses. In risk-adjusted payment models, such as Medicare Advantage, HCC codes help determine the level of reimbursement a healthcare provider receives for treating a patient. These codes reflect a patient's overall health and the severity of their medical conditions, ensuring that the reimbursement amount aligns with the complexity of care needed. When HCC gaps exist, patients' health risks may be underreported, leading to financial shortfalls for healthcare providers. Beyond reimbursement, inaccurate coding can also result in compliance issues. Medicare diligently audits claims to ensure accuracy, and any discrepancies could lead to penalties, further emphasizing the importance of accurate HCC risk adjustment coding. But HCC gaps don't just affect the bottom line, they can also impact patient care. A lack of comprehensive documentation means that healthcare providers may not have all the necessary information to offer the best treatment options for patients with chronic conditions. Closing these gaps is a critical priority not only for compliance and reimbursement, but also for ensuring patients receive the care they deserve. Strategies for improving coding accuracy and closing HCC gaps. Closing HCC gaps requires a proactive approach, with strategies focusing on improving coding accuracy and ensuring consistent documentation. These steps allow healthcare providers to improve compliance, enhance patient care, and maximize reimbursement outcomes. 1. Invest in regular audits. Regular audits are among the most effective ways to identify and close HCC gaps. These audits allow organizations to review coding practices and documentation, ensuring that all relevant diagnoses are captured accurately. Auditors should pay particular attention to chronic conditions that might have been overlooked in previous coding. Regular audits can also identify patterns of coding errors, helping providers target training programs where they're most needed. Providers can correct errors proactively and avoid costly penalties by conducting internal audits before external regulators do. 2. Focus on continuous training. Ongoing education and training for coders and healthcare providers are critical for closing HCC gaps. The complexity of risk adjustment coding and the ever-evolving guidelines for HCC risk adjustment coding require coders to stay up to date with the latest requirements. Healthcare organizations can significantly improve their coding accuracy by investing in continuous training. Training programs should focus on common coding mistakes, such as underreporting chronic conditions or failing to document specific diagnoses correctly. By addressing these issues head-on, healthcare providers can reduce the likelihood of missing HCCs and ensure their coding processes remain accurate and compliant. 3. Leverage technology and AI tools. Technology, particularly AI-driven software, is transforming the landscape of healthcare coding. By leveraging predictive analytics and natural language processing (NLP) tools, healthcare organizations can more easily identify HCC gaps. These technologies analyze patient data, flagging potential errors or misdiagnoses that could lead to gaps in HCC coding. Many advanced tools that integrate with electronic health record (EHR) systems are now available. These tools automatically scan for incomplete or incorrect documentation. These solutions help coders detect missing information, ensuring that every relevant diagnosis is documented and coded appropriately. As healthcare organizations continue to adopt technology, these AI-driven tools can be powerful allies in closing HCC gaps and improving overall compliance. 4. Strengthen provider-coder collaboration. Often, HCC gaps arise due to a need for more communication between healthcare providers and coders. Providers may focus primarily on treating patients, while coders handle the documentation without fully understanding the nuances of the patient's care. Strengthening collaboration between these two groups can significantly improve coding accuracy. By encouraging regular communication, coders can ask clarifying questions, and providers can ensure that the necessary diagnoses are documented clearly. This collaboration helps ensure the coders have all the necessary information to assign the correct HCC codes. Establishing a workflow where providers review and sign off on coded records in many healthcare settings can help bridge this gap. 5. Improve documentation practices. Accurate documentation is essential for closing HCC gaps. Providers must ensure that their patient records include all relevant diagnoses, particularly chronic conditions that may not be immediately obvious but still require ongoing management. Providers should be trained to document every diagnosis during each patient visit, as missing diagnoses or vague descriptions can lead to gaps in coding. Implementing best practices for documentation, such as using structured templates within EHR systems, can also help reduce variability in how conditions are recorded. By prioritizing thorough documentation, healthcare providers can prevent HCC gaps from forming in the first place. 6. Conduct retrospective chart reviews. Retrospective chart reviews offer healthcare providers another layer of protection against HCC gaps. These reviews allow coders and auditors to examine previous patient encounters, ensuring that all relevant diagnoses have been captured and coded appropriately. Retrospective reviews can also catch missed documentation opportunities, helping close any gaps that may have occurred in real-time coding processes. Additionally, conducting retrospective reviews provides an opportunity to train providers on areas where documentation may have been insufficient, reinforcing the importance of accurate coding practices. The benefits of closing HCC gaps. Addressing HCC gaps can have a wide-reaching impact on a healthcare organization. Proactively closing these gaps has numerous benefits, from improving coding accuracy to ensuring compliance. By adopting strategies such as regular audits, continuous training, and technology, healthcare providers can minimize coding errors, improve patient care, and secure the correct level of reimbursement for their services. Furthermore, closing HCC gaps helps healthcare organizations avoid compliance issues and mitigate the risk of penalties. Medicare Advantage plans, in particular, are subject to rigorous audits, and any discrepancies in coding can lead to financial penalties or reimbursement clawbacks. By proactively addressing gaps, healthcare organizations can avoid these costly mistakes and focus on delivering high-quality care. Conclusion. For healthcare providers and coders, closing HCC gaps is critical to achieving coding accuracy, maintaining compliance, and securing proper reimbursement. The challenges of HCC risk adjustment coding may seem overwhelming, but these gaps can be effectively addressed by adopting a proactive approach and implementing best practices. From leveraging technology and conducting regular audits to improving documentation and collaboration, healthcare organizations can ensure they meet both regulatory requirements and patient care standards. With the right tools and strategies in place, closing HCC gaps becomes a necessity and an opportunity to optimize risk adjustment coding for long-term success.